Bismillahirrahmanirrahim. Today lecture is about hyperthyroidism, grave disease. Robert James Graves, March 1796, March 1853, was an eminent Irish surgeon after whom grave disease takes its name. Grave disease, hyperthyroidism. Grave disease is the most common cause of hyperthyroidism. It is due to an abnormal immune system response that causes the thyroid gland to produce too much thyroid hormone. Grave disease is most common in women over age 20, but the disorder can occur at any age and can affect men as well. Grave disease, hyperthyroidism. Grave disease is type of hyperthyroidism that is due to production of autoantibody against the thyroid-stimulating hormone receptor on the follicular epithelial cell. This is thyroid follicular cells on which receptor for thyroid-stimulating hormone TSH is present, and these antibodies are produced against these receptors. These antibodies have the same structure like thyroid stimulating hormone and they attach to these receptors. These are autoantibodies. These antibodies mimic the effect of thyroid stimulating hormone and cause overproduction and release of thyroid hormone. These substances are immunoglobulin antibodies that bind with same membrane receptor that bind thyroid stimulating hormone. This is a receptor to which thyroid stimulating hormone is attached in normal conditions. But these antibodies, when produced, they attach to the same receptor to which thyroid stimulating hormone are attached. Effect of thyroid stimulating immunoglobulin, in short, it is also called TSI. They include continual activation of the cyclic AMP system of the cell with resulting development of hyperthyroidism. When these antibodies attach to the receptor, they continuously stimulate the receptors and then result to develop hyperthyroidism. These antibodies are called thyroid stimulating immunoglobulin TSI. They have a prolonged stimulating effect on the thyroid gland lasting for as long as 12 hours, in contrast to a little over 1 hour of thyroid stimulating hormone. When thyroid stimulating hormone attached to its receptor, the action is for only 1 hour, but when these antibodies attach to the same receptor, the action is as long as 12 hours. The high level of thyroid hormone secretion caused by thyroid stimulating immunoglobulin in turn suppress anterior pituitary formation of thyroid stimulating hormone, also cause suppression of secretion of thyroid stimulating hormone by the anterior pituitary, and the whole action is then overpowered by these antibodies. Pathology of hyperthyroidism. In most patients with hyperthyroidism, the thyroid gland is increased 2 to 3 times normal size, with tremendous hyperplasia and enfolding of the follicular cell lining into the follicle, so that the number of follicles increase greatly. This is a follicle. Here the follicular cell number are increased and there is enfolding of these cell into the follicle. Also its cell increase its rate of secretion several fold. Radioactive iodine uptake study indicate that some of these hyperplastic glands secrete thyroid hormone at a rate 5 to 15 times than normal. Regulation of thyroid hormone secretion. Let us understand the hypothalamic pituitary thyroid axis. Thyrotropin releasing hormone TRH is secreted by nerve ending in the hypothalamus. Why it is called thyrotropin releasing hormone? Because they are secreted by cells which are located in the hypothalamus and called thyrotropin cells. The thyroid releasing hormone is then transported to the anterior pituitary by way of the hypothalamic hypophyseal portal blood. From here, by blood, it is transported to the anterior pituitary. Thyroid-stimulating hormone is first to bind with thyroid-releasing hormone receptor in the pituitary cell membrane. In pituitary gland, the cell which produce thyroid-releasing hormone, this thyroid-releasing hormone, in anterior pituitary we have cell which release thyroid-stimulating hormone. To this cell, the thyroid-releasing hormone is attached and stimulate the release of thyroid-stimulating hormone. Thus, from the anterior pituitary gland increase thyroid secretion. Thyroid-stimulating hormone from the anterior pituitary gland increase thyroid secretion. This hormone increase the secretion of thyroxine and triiodothyronine by the thyroid gland. Its specific effect on the thyroid gland are as follow. Increase proteolysis of the thyroglobulin that has already been stored in the follicle with resultant release of thyroid hormone into the circulating blood and diminishment of the follicular substance itself. Feedback effect of thyroid hormone to decrease anterior pituitary secretion of thyroid-stimulating hormone. Increased thyroid hormone in the body fluid decrease secretion of thyroid-stimulating hormone by the anterior pituitary. When thyroid-releasing hormone act on thyroid, it causes release of T3 and T4. This is a positive effect of thyroid-stimulating hormone on thyroid gland. When T3 and T4 rises in the blood, it acts on the anterior pituitary. When the rate of thyroid hormone secretion rises to about 1.7 times of the normal, the rate of thyroid-stimulating hormone secretion falls essentially to zero. When the hormone is released from the thyroid gland about 1.5 times more than normal, the rate of thyroid secretion falls essentially to zero. Almost all this feedback depressant effect occur even when the anterior pituitary has been separated from the hypothalamus. When this connection is cut down from the hypothalamus, still this mechanism exists, that when there is increase in the quantity of T3 and T4 or concentration of T3 and T4 in the blood, the TSH secretion is depressed. Therefore, it is probable that increased thyroid hormone inhibit anterior pituitary secretion of thyroid-stimulating hormone mainly by a direct effect on the anterior pituitary gland itself. To maintain an almost constant concentration of free thyroid hormone in the circulating blood fluid. Effect of thyroid-stimulating immunoglobulin on hormone secretion. TSI increase activity of iodide form, which increase the rate of iodide tapering in the glandular cell, sometimes increase the rate of intracellular to extracellular iodine concentration to as much as 8 times of normal. Increase iodination of thyroxine to form the thyroid hormone. increased size and increased secretory activity of thyroid cell. The size of a thyroid cell is increased and secretory activity of thyroid cell is also increased. Increased number of thyroid cell plus a change from cuboidal to columnar cell and much infolding of the thyroid epithelium into the follicular, into the follicles. The most important effect of TSI is to initiate proteolysis of the thyroglobulin, which cause release of thyroxine and triiodothyronine into the blood. So the action of this immunoglobulin is same as that of the thyroid stimulating hormone, but it is for longer duration and excessive amount of or excessive concentration of thyroid hormone. Thyroid hormones are released into the circulation. Increased cyclic adenosine monophosphate mediate the stimulatory effect of TSI. These effects result from activation of the second messenger, cyclic adenosine monophosphate, cyclic AMP system of the cell. The binding of TSI with specific thyroid stimulating hormone receptor on the basal membrane surface of the thyroid cell. This then activates adenyl cyclase in the membrane, which increase the formation of cyclic AMP inside the cell. Finally, the cyclic AMP acts as a second messenger to activate protein kinase. Protein kinase actually transport tyrosine into the lumen of the follicle. The result is both increase in secretion of thyroid hormone and prolonged growth of thyroid glandular tissue itself. Sign of hyperthyroidism. The most common sign of hyperthyroidism is exophthalmos. This is the sign of Graves' disease. This is protrusion of the eyeball is called exophthalmos. Exophthalmos occur in about 1/3 of the hyperthyroid patient, and the condition sometimes becomes so severe that the eyeball protrusion stretch optic nerve enough to damage vision. Eye are damaged because the eye do not close completely when the person blinks or is asleep. As a result, the epithelial surface of the eyeball dry and irritated and often infected, resulting in ulceration of the cornea. The cause of exophthalmos. The cause of protruding eye is edematous swelling of retroorbital tissue and degenerative change in the extraocular muscles. In most fashion, immunoglobulin can found in the blood that react with eye muscle. Those immunoglobulin which react with the thyroid cells also act with the muscle of the eye and bring these changes in the eyeball. Furthermore, the concentration of these immunoglobulin is usually highest in patients who have high concentration of TSI. Therefore, there is much reason to believe that exophthalmos, like hypothyroidism itself, is an autoimmune process. The exophthalmos usually is greatly ameliorated with treatment of hyperthyroidism. When treatment for hyperthyroidism is given, this condition also subsides. Graves' dermopathy. Rarely people who have Graves' disease develop a reddish thickening of the skin that resemble the texture of an orange peel. Graves' disease. This is an orange and it has a covering which is called orange peel, and the condition developed in skin in dermopathy is similar to the peel of the orange. It often occurs on the shine and on the top of the feet. This is the shine, the tibia and top of the feet in this area. This condition occurs. Thyroid adenoma. Thyroid adenoma are homogeneous, solitary and encapsulated tumor. They are usually classified as follicular or papillary. The follicular type is the most common type. Hyperthyroidism occasionally results from a localized adenoma, a tumor that develops in the thyroid tissue and secrete large quantity of thyroid hormone, or adenoma, and they secrete large quantity of thyroid hormone. This is different from hyperthyroidism in that it usually is not associated with evidence of any autoimmune disease. In thyroid adenoma, there is no antibody detected in the plasma or blood of the person. An interesting effect of the adenoma is that as long as it continues to secrete large quantity of thyroid hormone, secretory function in the remainder of the thyroid gland is almost totally inhibited because the thyroid hormone from the adenoma depresses the production of TSH by the pituitary gland. This gland causes suppression of TSH, and that's why the rest of the gland stop production of thyroid hormone. Symptom of hyperthyroidism. The symptoms of hyperthyroidism are a high state of excitability. Person is highly excitable, intolerance to heat, increased sweating, mild to extreme weight loss, sometimes as much as 100 pounds, very degree of diarrhea, and increased appetite. Although the appetite is increased, but due to diarrhea, the patient and high metabolic rate, the patient burn his calories and he lose weight. Muscle weakness, he lose weight, his muscle become weakened. Nervousness or other psychic disorder, as he is highly excitable, so he is nervous and has psychiatric disorders. Extreme fatigue but inability to sleep. He is tired but cannot sleep, and tremor of the hands. If you will extend both his hand, you will find tremor in his finger and hands. Post-menopausal-like syndrome. Sometimes hyperthyroidism in women are taken by mistake as post-menopause-like syndrome. Roundabout same symptoms also found in post-menopausal female for some months or years. Diagnosis of hyperthyroidism. Hyperthyroidism is diagnosed with a medical history, physical examination, and blood test. Blood tests that measure the hormone T4 and T3 and thyroid-stimulating hormone TSH can confirm a diagnosis of hyperthyroidism. This is called TFT, thyroid function test. A high level of T4 and low level of TSH is common in people with hyperthyroidism. Blood tests are particularly important for older adults because they may not have classic symptom of hyperthyroidism. Thyroid blood tests may give false result if a patient is taking biotin. Biotin is vitamin B7 is a B vitamin supplement that also may be found in multivitamins. Biotin play a vital role in assisting enzyme to break down fats, carbohydrate and protein in food. It also helps to regulate signals sent by cell and the activity of genes. Radioactive iodine uptake test. For this test, a small safe dose of radioactive iodine, which is also called radiotracer, is taken by mouth to see how much of it thyroid absorbed. After 6 and 24 hours later, scan uptake with a device called a gamma probe to see how much of radioactive iodine thyroid has absorbed. If thyroid has absorbed a lot of the radioactive iodine, it means that thyroid gland is producing too much thyroxine T4. If this is the case, you must likely have grave disease or thyroid nodule. Other diagnostic tests for hyperthyroidism. The most accurate diagnostic test is direct measurement of concentration of free thyroxine and sometimes triiodothyronine in the plasma using appropriate radioimmunoassay procedure. Other tests that are sometimes used are as follow. The basal metabolic rate is usually increased to 30 to 60 in severe hyperthyroidism. The concentration of TSH in the plasma is measured by radioimmunoassay. In the usual type of thyrotoxicosis, enteric pituitary secretion of thyroid-stimulating hormone is so completely suppressed by the large amount of circulating thyroxine T4 and triiodothyronine T3 that there is almost no plasma TSH. Treatment of hyperthyroidism. We can treat hyperthyroidism by medication. Medicines are metamizole, tepazole or profylthiouracil and carbamazole. The trade name is numercazole. And surgery. This is the metamizole available, which is not available here in Pakistan but available in USA and with the name of tepazole, procarbazole. This is the trade name of profylthiouracil and numercazole, the trade name of carbimazole. Antithyroid drug, metamizole, tepazole or profylthiouracil. These drugs block the ability of thyroid to make hormone. They offer rapid control of thyroid. Metamizole uses. It is used in the treatment of hyperthyroidism in patients with Graves' disease or atoxic multinodular goiter. Surgery or radioactive iodine therapy is not appreciated. It is used in those patients where surgery and radioactive iodine therapy is contraindicated. In preparation for thyroidectomy or radioactive iodine therapy, it can be used to ameliorate the hyperthyroid symptom. It is used before surgery. Carbimazole, numercazole is not available in the US. However, in most countries, including Pakistan, carbimazole is commonly used where metamizole is not available. Metamizole and carbimazole are not equal on a mg basis, milligram basis. That is 0.6 milligram of metamizole is equal to 1 milligram or carbamazole. Radioactive iodine. Radioactive iodine is an oral medication that overactive thyroid cell absorb. The radioactive iodine damage these cells and cause thyroid to shrink and thyroid hormone level to go down over a few weeks. When this radioactive iodine is given, it is absorbed by the thyroid cell and then they cause a destruction of these hyperactive cells. This usually leads to permanent destruction of the thyroid, which will cure hyperthyroidism. The amount of radiation delivered by the medication is different from the amount used for the radioactive iodine uptake test and scan for diagnosis. The radioactive iodine is used both in diagnosis of the hyperthyroidism and treatment of hyperthyroidism, but the dose per treatment is higher than the diagnostic dose. Most people who receive this treatment have to take thyroid hormone drug for the rest of their lives to maintain normal hormone level, because these radioactive iodine totally destroy the thyroid cell. Hypothyroidism occur in the patient. The patient then take thyroid hormone for the rest of his life. Beta blockers. These drugs block the action of thyroid hormone on the body. They do not change the level of hormone in blood, but they can help manage symptoms like rapid heartbeat, nervousness, and shaking that are caused by hyperthyroidism. Medication side effect. The two medications that can treat hyperthyroidism are methimazole and propylthiouracil. These drugs can cause severe side effects. One rare side effect that affects less than 1% of people is potential liver damage, which may be permanent in the case of propylthiouracil. Another rare, less than 1% but serious side effect is a granulocytosis, destruction of granular cell or white granular cell count. In pregnant people, this medication can pass from parent to the fetus through the placenta. This could cause hypothyroidism or the development of goiter in the fetus. There's also a possibility of an allergic reaction to these medications, which occur in about 5% of people. Physiology of treatment and in hyperthyroidism. The most direct treatment of hyperthyroidism is surgical removal of most of the thyroid gland. In general, it is desirable to prepare the patient for surgical removal of the gland before operation. This is done by administration of propylthiouracil, usually for several weeks until the basal metabolic rate of the patient has returned to normal. Then administration of high concentration of iodide for 1 to 2 weeks immediately before operation causes the gland itself to reduce in size and its blood supply to diminish. So two things before operation are done: propylthiouracil and administration of high concentration of iodide, which cause reduction in the blood supply of the thyroid gland. By using these pre-operative procedure, the operative mortality is less than 1 in 1,000 in the better hospital, where before development of modern procedure, operative mortality was 1 in 25. When this procedure was not adopted in past, the mortality was 1 death in 25 operations. Risk linked to surgery. There are always certain risks linked to surgery like infection and bleeding. Surgery generally considered very effective treatment for hyperthyroidism. In rare situations, complications like paralysis of the vocal cord, inability to speak, and damage to parathyroid gland can happen, which are located on the dorsal aspect of the thyroid gland, which result in low calcium in blood. What is the outlook prognosis for hyperthyroidism? Hyperthyroidism is a manageable and treatable condition, and most people do well with treatment. While some form of treatment required to take medication for the rest of life. Unfortunately, untreated hyperthyroidism caused by grave disease may get worse over time and cause complication. What happens if hyperthyroidism is left untreated? Hyperthyroidism can affect many parts of the body. Different systems ranging from vascular system, heart to skeletal system, bone can all be affected having an overactive thyroid. Complications from untreated or untreated hyperthyroidism include atrial fibrillation, stroke, congestive heart failure, and osteoporosis. What are the risk factors for hyperthyroidism? Some factors that could increase risk for development hyperthyroidism can increase having a family history of thyroid disease, having a medical history that include conditions like pernicious anemia, type 1 diabetes, and primary adrenal insufficiency, Addison's disease, having a lot of iodine in diet, and being pregnant. Hyperthyroidism versus thyrotoxicosis. Thyrotoxicosis and hyperthyroidism don't mean the same thing, even though they are sometimes used interchangeably. Hyperthyroidism refers to thyroid's physical overproduction of hormone. Thyrotoxicosis refers more broadly to the presence of too much thyroid hormone in body, regardless of whether it came from the gland, medication, or other causes like autoimmune disease such as Graves' disease or Lummer disease. Certain medications such as lithium, amiodarone, or aspirin, viral infection, thyroid inflammation, or thyroid cancer. High iodine level. Graves' disease. So there are some MCQs in this lectures. Please select the right options. Hyperactivity. Please read the stems and select the right answer. If your choice is C, this is the correct option. And in question 2 also, if you have selected the C, this is also the correct answer. In question 3, please read out the stem and the options. The right option is C. And here the right option is D. For this you need to pause the video and read the stems and options and select your choice. So thank you. Please subscribe the channel. Write down your valuable comments in the comment box and down the bell icon for upcoming notification when new lecture is uploaded. So thank you once again.